either virtually raise your hand or let us know by kind of chiming in, and we'll see if we can get to your question.
We lost all sound. Should be working. Can anybody hear me? I don't know what changed. Attendees will full auto. Yes. Why? I'm sorry, everyone. I don't know why you were all muted, but you shouldn't be. All buttons don't indicate that you are to me. You're all got microphones that are green to me. Am I missing something? Hey, Zach.
So it shows that the organizer muted all of us, so I'm assuming you have some control over that.
Yeah, and it doesn't appear that whatever I did, I can undo. It says I've got full it says everybody's on.
Weird. Okay. From our end, it shows that we're muted by the organizer.
Yeah,
Maybe just try clicking on it twice or something.
I'm going to give you control.
Okay.
Okay.
Yeah, it says that I'm still muted by the organizer.
When I go to audience view, well, this is very frustrating.
Yeah.
Because there's not a single button that I can hit that seems to allow any change.
Is Mike Wells available? Could he hop on this?
I would have to call him. Meetings, which I can do.
Okay. I'll hang up if you want.
Yeah, let me call him right now and see what I can figure out. Because it appears that everything on my side is doing what it's supposed to do. Ray Dick says she's actually calling Mike Wells right now. All entire audience. Attendees. What about now? So there's one, for those of you who can hear me, there's one button that says unmute all participants. And when I click on it, it says attendees will have full audio control and may unmute themselves at any time. I click yes. And nothing happens. Let's see. How about now? No. Yeah, attendees will have full audio control.
Okay, I think whatever happened worked. So can you guys hear me?
I can hear you, Zach.
Sue, can you hear me?
Sue?
So Michelle can hear Jeff and I, right, Michelle?
Sue says she's self-muted.
Yeah, Sue is self-muted. How are
Now-
you able to there we go.
I'm on now. Okay. Can you hear me now?
Now
Yep.
I'm on.
Oh, wait, I think I'm unmuted.
Michelle?
Cool.
No, it's Joanne. I don't have a camera on my laptop. I'll put it on my computer. I'm still at work.
Yeah.
Okay. Hey, Joanne.
Kayla self.
Michelle, try to unmute.
There we go.
Click both
Ooh.
red buttons.
Gotcha,
can't-
Michelle.
I got you,
Does that
Michelle.
work? All
Yeah.
right, I'm back. All right, we're back.
We're back.
Oh, if only I had this power at a board meeting, like in person. I could just
To what, mute people?
Beautiful.
Right. Good, I'm
Okay,
glad I
so,
didn't miss anything.
Okay, we're good.
okay, so I think we left off. We were discussing Middlesex Conservation Commission. They were planning on holding a plants fundraiser, but I think they've pushed that off. Jeff, you're right. You have an update on that?
Zach, you broke up for me. Say that one more time.
So the Middlesex Conservation Commission was planning on a plant fundraiser, and I think they pushed off the date.
Yes, they did. What I asked them to do was to reconsider doing their fundraiser. Their fundraiser is selling plants, and they sell several hundred plants, and they have people pick them up. And they usually do it at Kimball Farm. What my concern is, with Kimball Farm already doing their operation, having another 300 people go in and buy plants doesn't really feel like an essential part of what the governor's order is. And at least with Kimball Farm, we can attribute it directly to what the order says about takeout. and fundraisers I don't feel are addressed. So I have asked them to reconsider having this right now. And they've moved it back 2 weeks into the early part of May. And I'm hoping that maybe at the early part of May, they'll be able to hold that event and be able to run it on their own. So right now, we don't have any problem with them running that event because it's now almost 6 weeks away again.
Sue?
Sue, go ahead.
Yeah, so did these people already pay, Jeff?
I'm not sure what their arrangement is, but I know they hadn't put the tent up yet that they needed to use.
Okay. No, I was just thinking if, like if they've already paid, maybe there could be a place. I would not do it at Kimball's because of the, like you say, what's already going on there. But why couldn't they put their tent in that big parking lot to the right where they have the car shows and stuff like that? Only if they've already paid. Like, for example, I'm part of that, I get the lettuce delivered still from, you know, I'm part of the Greens program. So the way they've been doing it is they've been dropping it off at a farm stand and we pick it up from there. So only if
Right.
people have already paid, but if they haven't paid, I would say hold off.
Michelle?
So I'm not sure who the organization is, but every year there's typically a big plant sale at the 4-H grounds. And usually you can order plants ahead of time and pick them up, or you can just go and shop. So is this a different organization, or is this potentially a location where they could move to?
They have actually run this plant sale there in the past. So I might be a different organization because I think they've been using the past 2 or 3. But my concern is with, as we're seeing numbers ramp up and us not maybe hitting the top of this surge, having them run a plant sale in the middle of the surge just didn't feel right to me.
Yeah, I agree.
So right now they've kind of relented and realized maybe they should back off a couple of weeks. I'm very grateful that they did so, and I want them to go forward. It is a major fundraiser for them, but I just need to make sure that we're at least looking at what the ramifications of putting that many more people on that site would be.
There's been a lot of fundraisers that have had to be pushed way back. So, you know, I was supposed to go to a couple of fundraisers for different organizations, the Habitat, the, you know, 50 Legs. So, you know, I understand these are big fundraisers for people, but there's been a lot of fundraisers we've already had to push way, way back.
Right.
Right. So they've been able to do that for the time being. I'll work with them as best we can and make sure that they can go forward. But it was a real big concern to me to add another draw that is going to bring more people to a big place.
Agreed.
Then Jeff, you were talking about septic inspections earlier and how there's some you know, people in town who need those inspections. So can you give us an update on what the department is doing?
Sure. So what's been happening is we've scaled back our inspections pretty drastically to only handle emergencies. Well, what we're finding out is, well, we haven't been doing our typical inspection for the past, well, probably 3 weeks. People had still bought houses and had registered sales signed and closings were in place. And some of those events are now coming due. And the one thing that I really don't want to do is somebody who's got several $100,000 in jeopardy of either losing some of that money or losing the sale of their house, or not being able to buy one. So what we're looking at is where all those inspections happen outside, and I do consider that kind of money somewhat of an emergent issue. I think all of us would if we were in danger of losing a significant amount of money. We're going to start scheduling those inspections in a safe manner that we can make sure that the people that need a system put in or the inspection done, that they'll be able to either meet their closing or come close to meet their closing if they can push it back a hair so they can get the systems in and get the properties sold. One thing that's a big concern for me and the staff is concerned for themselves is that we want to make sure that whenever they're out there, they're doing it as safe as possible. We're just going to implement some minor protocol to make sure that we're increasing our social distancing, maybe from beyond 6 feet to 10. If there's a need for any specific PPE, they have it out in the field. And to make sure that generally the inspection can go off and we're not risking the safety of any. Other towns are doing the inspections, so we feel that it's going to be a big benefit to the residents to make sure that we can do them. And we're just going to make adjustments so we can fit it into our work schedule while still maintaining our social distance at the office.
Okay, thank you. Any questions for Jeff? Any questions from our attendees? Next is the Mass Department of Health had an update today. I believe, Jeff, you were on that call. If you could just give us maybe a summary or points that that stood out to you. I think,
Yeah, so obviously part of it had to do with the governor's order extending the social distance ban until May 4th. So that was a fairly big part of that. One thing that came up that I thought was interesting is there was a discussion that the state would only like communities to report the county numbers on positive cases in town. We've been reporting the local number of cases, and our current number is 14 as of right now. That may jump by the morning if more cases come into the Maven system. But currently our number is 14, and I think we've already let that horse out of the barn. And I think people feel that's an important number to know. So until that number gets unmanageable, I would like to consider keeping people abreast of what our numbers are at the local level till they get to a point that we can't easily manage that. I'm hoping we don't get to that, but that's something I would like to do. And one thing about our local numbers that I think are important is people will see it when I post it every day to 2 days. It will jump maybe up or down or stay the same. And that's for a couple of reasons. There are people that are becoming healthy that are coming off of that list, so they're no longer a positive case. There are people that we are going to have in town that will unfortunately have the worst fate possible, and they will come off that list. And there are people that will just have families that may have several cases in the same household. So you may have 4 to 5 cases in one house, which will make that number look maybe slightly bigger than what it really is. And what I really think is important with whatever our local number for cases is, it's pretty clear that COVID has gone into our community and it is spreading at a community level. And regardless of what we have for a number that we're reporting, every single one of us need to continue to do our jobs, to social distance, to wash our hands, stay home when we're sick, and seek medical care when we need it. So regardless of whether our number is 14 or 140, the message doesn't change. We need to make sure we're doing the same things until we get in front of this.
So if I can make a comment, just, being still at work, that, what you said is completely true. That number is really kind of arbitrarily meaningless, only because it does change. It can change in the course of the day. So, going forward, lots of places have decided not to, continue on with that number. It kind of is a meaningless number, but people like to see it. So, it's going to become more and more difficult in the next couple of months.
Okay, thank you, Joanne. Stephanie?
I can't find it actually on the webpage, but are you listing it, Jeff, then as active COVID cases in town? Because we can't list it as positive tests if you're reporting it up and down.
So the number does change up and down. It's going to. So
Right,
it's,
but it can't, if you're listing it as test positive, then that can't change that way. That would be an improper listing of the number. It should say,
Well, that's the point. Whether it's a cumulative number or a daily number, is this positive, is this total in general? This is why the number's kind of arbitrary.
so I guess I look at it as if I'm going to report the numbers, Stephanie, I'm
yeah,
going to report the number of positive cases in town right then. So
Okay, and
that
is
number,
is it listed that way? Because most places are listing as positive test results, and then they list out other, cleared deaths, and
You're not doing that. A lot of this are not.
positive cases in town.
No, we should not start doing how many people we had on and how many people come off and how many people are this and that and the other thing. That's not appropriate.
Right, I don't know if having that number change other than,
Michelle has something to say.
Yeah, Michelle?
So I had a neighbor ask me last week when we had our first death. We had posted on the website that there were 7 positive cases in town, and then the next day it said 6. And so she said to me, well, does that mean that the dead person was taken off of the total? And are we not reporting that how many deaths there are in addition to how many positive cases we have?
so I can continue to put numbers up there, and whatever the positive number of cases we have, cumulative, I can do that. But I guess the way I looked at it was I was going to give people the amount of people that were active right then and there.
Because some people go into the hospital, come off the list, some people will recover, they'll come off the list. So just because the number goes down doesn't mean anything. You could have 2 people come on and 3 people come off. If that number doesn't really mean anything. So, anyway.
Sue?
I mean, but why couldn't we just say positive cases and active cases? So, like, in other words,
Positive case is an active case.
I
yeah,
beg your pardon?
A positive case is an active case.
No. Because what I'm saying is we list the amount of positive cases we have had.
so it
Like,
would be,
this
active
taking people off and on a list, I think, is confusing to people. So,
Exactly.
like, to me, positive is a cumulative. We've had so many positive cases, and currently we have so many active positive cases. So why
And
can't
should we
we
be
have the
reporting deaths?
overall
No.
current positive?
I'm just gonna tell you from doing this every day, that's a lot of work. There's a lot of work going on when you get 7 cases in one day, 7 positive cases in one day to do all the contact testing. And then at the end of the day, try to figure out who came on, who came off, what's the cumulative. That is an unbelievable amount of work to be able to do.
I'm going to start helping Gail. So,
It's got, you will see. So
well,
it's a lot of work.
Can
So
I,
I guess what I need for you guys to do is
but Gail wants to say
you want me
something.
to report.
I'm sorry. I think I'm going to kind of go off of what Joanne just said, is that as a public health nurse, this is what I do from the moment I wake up until the time I go to bed. I am doing constant, and I mean constant surveillance and touching base with everybody, and I am monitoring people, and I am just, it's a constant thing, and it changes, and some of them are positive and some of them have many family members and so on and so forth. So as Joanne was just saying, it's going to become very difficult. And thank you, Sue, though. I can't wait for your shared help. And the same with you, Stephanie, for your offer. It's just wonderful. It will be, hopefully, I'm praying that we will not have the surge in Westford as they're anticipating this surge in the next 2 weeks. But I am certainly working is so much on this, and keeping, abreast of all of the situations, and I'm reporting it to Jeff when necessary, in regards to the people, with cases, but just know that, I'm hoping it doesn't get to a point where it's becoming so unmanageable that it's hard to report. I think my only advice is that it's not so much the number of people anymore. It's really self-quarantining yourself almost. Everyone should just really be practicing social distancing at this point, regardless of who's positive, because sometimes you don't even know who is and who isn't. And I really want to just put out there that if you follow all the directions that are being told by the governor and the Department of Public Health and the CDC recommendations, it would be so wonderful. I see a lot of people when I drive around town, when I actually leave my house, which is very infrequent, to see a whole bunch of children in the neighborhood all playing together. And I just want to put a stop to all of that until we can just really get over this hump that we're gonna be going through. So, thank you.
Thanks for what you're doing, Dale.
Thank you.
Gail.
Thank you, guys.
That was
Jeff, I'm wondering if we shouldn't then follow what they recommended in the meeting today and not report the town numbers, because it does get confusing. I mean, I know we kind of enjoy seeing it, and it does point to the fact that it is here in town, but without actually saying active cases, resolved cases, deaths, and getting all those numbers in there, I think it's a difficult thing to report a number that's really got any meaning to it.
I agree, Stephanie. It's confusing.
Yep, I definitely agree.
Yeah.
But unfortunately, and I don't have, if I can come up with an answer, I'll tell you, but, people, in terms of this communication, people somehow feed off that number. So, how we go about doing it, I know what we're doing here is we're just giving them the total of the day. And that, and then basically it says we don't give out any more information for personal, privacy protection, but this is the number of the day. That's the number we're working on. We've got, 15 or 17 or 20, whatever we're working on in the day. We don't explain it further. I don't, like you said, the horse is out of the barn. You already started giving that number, it's out of the barn. But to try to do, at least on my level, and I think, for Gail, to try to start breaking it down further, trying to explain it further is really complicated. So, if you don't, I would suggest don't change. If you want to keep just saying, this is the number of the day, and leave it at that. At least it's reporting something, because people will then be like, well, now you're not telling us anything. You were telling us, and now you're not telling us. So, and it also, does kind of reinforce that it is in the community. If we can't explain it further, then we can't. But it is a number that's out there, and I think, reminding people that it's out there is not relaxing, But
So Jeff, have you been reporting every day? What have you been doing?
So I've been reporting the number of confirmed positive active cases in town almost every day. Additionally, I've been reporting what the state reports for Middlesex County. And what I at least I felt in my mind is, if you look at Middlesex County, let's see if I can tell you what that is right now. Middlesex County, as of today, has 1,340 people, and we are not the highest anymore. Suffolk County has moved ahead of us, but I do find, I don't know if I would call it, it makes me feel better or people feel better, but when I know we've only got active cases in town of 14, and we know there's that many more in the county, I think it gives people at least a correlation of where the numbers are for the town. Whether we're up one or down one or two because somebody is come off because they unfortunately have passed or
Recover, Jeff, be positive.
or happily have beaten it and have come off because of that. I just kind of felt it was easiest to manage the number of active cases that we had in town so people kind of knew where we stood. That was just the simplest math I could put onto it without making it into a really complex situation.
So could we just do it on a weekly basis or something? Like, I mean, instead of a daily basis, just maybe report by week how many cases? Because that does seem a lot to do it every single day to report.
It's overall not that much work, but I don't mind. I mean, it would be less for me. I'd be more than happy to do it at the end of the week.
Yeah, I don't think it makes, I don't know. I don't know what you guys think, but to me, wouldn't once a week make more sense than every day?
So Sue, at the end of every day, there's a report that can be run, because that's the report that we run in order to give the addresses to the EMS system.
Okay.
Like, I don't know if you've run that report or not, but, it's a simple report. You do it at 4 o'clock, and then you just count them up. There's your number. Is that the applications you're working on? Whether people came on or off during the day, it doesn't matter. We have a point in time. So that like 3:30, 4 we run it to 4 o'clock, you can handle your number. And the addresses, we have to do addresses. And that's a report.
So
that we run.
for me,
So,
it doesn't
you can
matter
do
much
that.
to continue to do daily.
And then you have a number. You just count it. But it does, if you miss a day, then somebody can go, oh, you missed a day. But
I agree. I think the day is fine, but Jeff, I think you need to change how it's described. Instead of saying there are X number of known confirmed cases in Westford, then it needs to say known confirmed active cases.
Yeah.
And that would resolve the question about why the number is going up or down.
I agree, because you know what, like we all kind of know what we're talking about here, but I think it's confusing to people in the community to, and I think what you just said, Stephanie, makes perfect sense. Just add that one word, known active, and that explains it, like you say.
But known confirmed is a big deal, because there are people that are clinically linked to a case or are tested for a different reason, like an EMS person, that is not a confirmed laboratory case. So it's a whole different issue in reporting. So that verbiage is important. So it's a confirmed case, not a rumor. It's not somebody who may be linked. It's not
So that's
somebody
what
who
you
was
said,
tested.
confirmed active.
Yeah,
Confirmed.
so I'm agreeing. I'm saying that's important to say confirmed. But there's a lot of rumors.
Yeah.
Which we're already. All right, well, I can add the word active. That's easy.
Thank you. Any other new news that came out of the MDH's phone call today, Jeff, that you want to share with us? And Stephanie, I guess you have a question before that?
Well, it was about that. I was curious, one of the things they discussed on the call was whether doctors' offices were reporting the presumed cases into Maven. And do we know, have our doctors been doing that locally, or are we?
No.
Can I add something? This is Gail. The answer is no to that. What a lot of patients are doing is they're calling their PCPs and they're giving them their symptoms, and they are presumed positive without an actual test. And so it does not go into Maven in regards to that because there is no test. But so no one actually notifies me on that. I'm hoping the doctor is telling them that they need to self-isolate until the symptoms have markedly improved. There's a whole CDC guideline to self-isolation versus quarantine. And there is a difference between isolation and quarantine. And that is what I spend my day explaining to people, what each of those mean, to what each person in the family has to do. But as far as the question in regards to PCPs, they'll just tell the patient that they're presumed positive, and they, as it has always been said, if you're sick, stay home. And a lot of people are hearing that, and they are staying home, and they are not being tested, and they're just getting over their illness without a diagnosis necessarily. So I don't see all of those cases. Yes.
So they did say today, though, in the call that the doctors are supposed to be reporting those through Maven.
Yeah, they haven't to me personally as of yet.
Okay, so they said they should be. They said that, they were going to try and get the Mass Department of Public Health to notify physicians to do that. But, if we're hearing questions from doctors, that would be something to feed back, is that, yes, in fact, this is a reportable disease, and any suspect cases need to be reported.
Right.
They're not on Maven. Doctors are not on Maven. They would not.
Right, so they would report them to you or to the
And then
department.
the state would have to report it back to them.
Right, so they were supposed to report to you or to the department.
Yeah, which they haven't done yet.
Yeah, so I had a chance to be on that webinar today with Maven, with DPH, and they were saying that presumed cases are not being reported, and they're at this point they're not asking them to be reported because it's kind of overwhelming what towns are dealing with right now. So at the state level, they're saying you don't have to report the presumed cases. Just
That's interesting, because that's not what they said on the other call.
that's funny. Gail, were you on that call today at 11?
I was on both. I've been on both of those conference calls. I've been on both of them. And so I heard both from Maven and I heard both from the DPH. So yes, I've been on both webinars. And
So that's a mixed message then.
it is. And right now they're just they're all trying to figure it out.
The real issue is, there's no reporting system yet for COVID like there is for flu or other things. So there isn't like a telephone like they do. So there isn't any way really for the physicians to report.
Yeah.
It's going to overwhelm the system. The thing is, if we have a household contact who develops symptoms, they're not going to test because they're going to assume that the household contact is positive. And we're going to follow through just like they are positive. And we're going to do it on our end, maybe. But it would overwhelm the system at this point. They would have. So it seems like a mixed message, but part of it is we're just going to have to do what we have. And, we can for household contact add it in, but we're not going to go searching for individual, a single person that shows up at the doctor's office. And that without a test, really, with no epi-link or no confirmed person that they were in contact with, really kind of doesn't exist.
At the DPH call and the epidemiologists, they just kept stressing the priority has to be on the lab confirmed cases.
Right.
That was they kept stressing that, not and their close contacts. So.
Yeah, so that's what I was saying. It would be that a close contact that then develop symptoms.
Yeah.
Right.
Zach, as far as the rest of the meeting goes, what was discussed was some things that don't apply to us, such as homeless shelter, because we don't have one in town. Guidance for short-term rentals, and really referring to the governor requesting that hotels not be renting places for vacation, but used for medical staff and people that may need to quarantine or may be displaced. Things like camp regs, how they're required to have a 90-day application in, and we have the ability locally to reduce that 90-day requirement if need be to hopefully get camps open for the summer. They touched on food permits, and which isn't a problem for us. Our food permits are done on the calendar year, so ours are done. But other places may be looking at different times of the year when they run their fiscal year. Farmers markets may be addressed. Currently, they're okay to run because they've been exempt, but there's going to be some new guidance coming out. If it's not out now, it'll be out by tomorrow on what is considered essential service. And there was some discussion on requirements for convenience stores and self-serve operations, which are still considered. And that was a lot to do with what the call was. We had some other people that were, there's going to be some language on expired N95 masks that's going to be coming out on are they okay to use. And then there's been a lot of requests for people that, is there any guidance for people that are asymptomatic first responders and should they be tested and when? And we're waiting for that guidance to come out from the state. There was one piece of information that I found really interesting that came out of Dr. Brown. If you recover from the virus, and more like when, because the vast majority of people do recover when you recover from the virus, you're able to return to work. But there is some evidence that after you're recovered, you may still test positive, but that's not considered a reinfection. There is a belief with this particular virus, because it is similar to SARS and MERS, that you do have a period of immunity. How long that is was not discussed. It could be weeks, it could be months, but people that are recovering are going to be able to return to their normal lives and go back to work, which I thought was kind of important for people to know, that there is, if you do become infected and you do recover, you're going to return to your normal life. And that was a lot of the call, or other smaller questions that people had about past directives, but nothing that we haven't covered in the past.
Thank you for the update. Any questions? Any other points that anyone who was on the call wanted to bring up? And any questions or comments from anyone else in the audience who might be in on the call? Feel free to raise your hand now or to join in on the conversation.
I'm afraid to touch a button. I muted all you last time.
I know. Yeah, I don't see anybody here. Is there any other questions or comments from board members? Anything they might discuss, Sue?
Sorry. So I know we talked about it the last time about beaches, because now you know they have closed all beaches, right? And I know our beaches are small, and obviously I know we want people to be able to walk and do all that, but I am a little worried even about Summer Village and those places that have beaches. I think we have to make sure that we are following the same thing at the state level, saying you can't be sitting on a beach, even though I know everybody would love to on a beautiful day, but beaches are technically closed in this state.
Stephanie?
And would that include private beaches?
Good question.
I mean, I want to just reiterate that the meaning behind the order is to keep large groups of people from meeting, or any groups of people from meeting. And there are certainly some beaches like that in town where large groups of people could meet. And I agree with you that, the beaches at Summer Village, at Edwards and so forth are large enough that large groups could meet. And if we have a nice day, people might decide to meet. So those definitely should be closed. I would assume, to your question, Stephanie, about private beaches, that as long as no one's having a party on them, that they're allowed to sit on them, because the point is to just keep groups from meeting and getting too close.
When did they close the beaches?
I'm sorry?
When did they close the beaches?
I don't remember them closing beaches.
Either.
I think
Is
we
it
need to make
just-
sure there's guidance on that. I'm not sure they've actually.
Well, I know New Hampshire is definitely closed, and somebody told, I know New Hampshire is.
Mass is
Well,
not.
that's okay. But
Mass is still not.
Correct.
no, I don't think so. I have
Okay.
not heard that.
Told me Ipswich, beaches in Ipswich were closed. So I would love to know that information because New Hampshire has definitely closed their beaches.
Well, Ipswich may have done that on their own, but I have not seen anything in Massachusetts that has closed beaches.
Okay.
Can
Yeah,
I
I
just
have-
say one thing? I'm sorry.
So,
Sure.
I just wanted to say that Maine and New Hampshire have closed their beaches, but Massachusetts has not.
Oh, they
Some
haven't.
communities are voting, boards of health are voting to close the beaches if they choose to. And if you do decide to close them, we would just need to know, is that public and semi-public or just one or the other or all? You know what I mean?
Yeah.
Thank you.
Yeah, I mean, this
So
goes
I
back to a tough problem, kind of like what we were talking about with Kimball's last week, which is that people need to have some semblance of normalcy. And for those who are enjoying the beaches properly, which is just to, sit on them by themselves or walk on them socially distant from other people, they are a source of calming. But I do totally agree that they are also attractive to young people who want to, get together and stuff. So that's not good. But so are parking lots and other
I know.
places like that. So, I mean, it is tough in these times to decide when to close something proactively because we have to kind of weigh both sides of it. So I'm leaning
So
towards,
should we just wait till we hear from the state level then?
I guess
Yeah.
so. I mean,
Or
if it
until
sounds
we
like
have
it's
a
going to be inevitable.
problem.
Well, I would
I think
hate to take something away proactive, at this point, we've taken so much away, and if they're not abusing it, maybe it's a signage thing. We don't want to close the beaches, so please remember social distancing, things like that. But we have, people who have private beaches, people who live on the lakes. And you're right, Zach. I mean, there's a lot of anger, there's a lot of fear, and, water is such a calming
Oh, I
thing.
love the beach.
And yeah, so I think if we can hold off on that, I would really fight for that one.
So do you know, so right now it's just New Hampshire and what did you say, Maine?
Yeah,
What about Rhode Island? Are they still open?
I don't know. I mean, we could, I like the idea of we could make some signage and put that up, especially with kids fishing and,
Yeah.
stuff like that, if you want. I saw a lot of people fishing today, but you need to be distanced to do that generally anyway, so it seemed to be
Yeah.
working well. Right.
And hopefully after you go fishing,
So
you're
I
washing
think-
your hands anyway, right?
I think as far as the mass beaches go, we need to pay attention to a few things. There are local beaches, there are community beaches, private beaches, and state beaches. And we haven't seen any of those close in this state. Revere Beach may be the first one that actually does close because it's getting overrun. And their mayor was very vocal about closing it if people did not stop abusing it. So I think we need to watch slowly. And if we see that the beaches are getting too crowded and people are not maintaining a reasonable social distance, I think at that point we consider closing locally, but I think we need to monitor first.
Can I ask one more question? I know we had talked, Stephanie, you had noticed a group of people gathering at one point in time recently, right, Stephanie? So if somebody notices a big group of people gathering, who should they be contacting and who should be following up on it?
Well, the order actually is enforced by the health department.